We are glad to have Congressman
Robert Aderholt from Alabama's 4th Congressional District.
Yes.
Welcome to the program. Glad you could join us.
Well, thank you. It's good to be on with both of you.
So tell us, Congressman, what's happening with the health care legislation up there on Capitol Hill?
Well, to be honest with you, those of us on the Republican side of the aisle are still trying to figure out what is going on and what the situation is. Right now, as you know, that the Democrat majority, the president, has laid out a sort of a plan, what they want to do, but there's still a lot of unanswered particulars in the bill as for specific areas, and so we're trying to find out what those are. They tell us, as far as the timeline goes, that they want to try to have a bill passed out of the House by the end of July, which is approaching very quickly. So, but basically, I think what their vision of it is basically a healthcare system that will be operated by the government. Now, I know that when the presidents ask about this, and when members who are defending this plan are asked about it, they speak in terms of people being able to keep what they have and being able to, no changes of what they currently are under right now. But the truth of the matter is that when government gets involved in this, none of the other programs will be able to compete. The private sector will be out because they simply won't be able to compete with the budget, with the gigantic federal government what they're providing. So basically, the end results is what so many of us are concerned about. Is it's going to be a government-run health care, and that is the only option.
Now, isn't it true that the president has said he favors a single-payer system, i.e., a straight government-run health care system?
Sure. No, I think that's absolutely right. But, I mean, if you notice what he says that people will still be able to keep what they have. But the truth of the matter is that I don't think any legislation that he'll propose that he will put forward will say that there can be no other alternatives. It's just a matter of the truth of the matter, when it's all said and done, the other insurance companies won't be able to compete, and they'll just go out of business. And so, therefore, it's a de facto decision that it'll be only a one-payer system.
Well, let me ask a question, just playing the other side of the street here. We already have a form of government-run health care. It's called Medicare and Medicaid, and it is already underfunded. We already have patients who are not getting treatments because Medicare and Medicaid refuse to pay for it, and they have now added this Plan B thing that you add to your Medicare and your Medicaid. Is this a sign of what a government-run health care is going to look like if it is instituted?
Well, I would think that, the sky's the limit as far as the cost goes for a government-run health care. And there's no doubt the bottom line is that taxes will have to be raised. And not only will taxes have to be raised to pay for a system like this, but also they'll have to be rationed in care, and which means that if you're over a certain age, then you would be ineligible to receive a particular treatment. And, of course, most Americans are used to the fact that they can go into a hospital and they can receive the treatment they need. If someone goes into an emergency room, by law, they have to be treated. And that's just, the way it is, regardless of your income and regardless of what your situation is. But, of course, I think, most Americans like the idea or think it's prudent to have health insurance, and of course it certainly is, and to try to get affordable health care insurance that will allow people to, I think one of the best things is have employer-based insurance. That they can, when I say employer-based, the employer could provide this as something for their employees, and so it makes it a great thing for the employers to be able to encourage people to come to their particular job, particular place of employment, work, or whatever their situation is. But I think all in all, it's how we can keep it more in the private sector as opposed to keeping it out of government. Is the bottom line.
Well, I think one of the bottom lines of medical reform in this country, and this is my own personal opinion, would be if we could put a limit on medical liability lawsuits, a cap on how much you can win from a doctor if you get a mistreatment, if they do something wrong or you think they do. I honestly, because I know so many physicians personally who are no longer practicing because they could not afford the medical liability insurance that they are required to carry. And it's just, it's really sad because their heart is in curing people and in helping people, and it's just astronomical what these physicians are having to pay.
Certainly. Well, I totally agree. And, certainly if someone has been wrong, they need to some way be compensated. But
$50 million because you got my left toe?
Yeah, exactly. There has to be a balance there, and I think we do need to work towards some kind of system that will put some kind of caps in there, because a lot of times the way that the attorneys for the patient sometimes portray this is completely, I think, out of context. I mean, anytime you have a situation like that, you don't want it to happen, but I think sometimes it needs to check whether it was something that was the doctor was just negligent in doing it, if the doctor was just not, doing his job, or whether it was, just simple oversight that, that needs to be rectified, but at the same time you can't put the doctor out of business just because, there's going to be a certain amount of human error.
Well, I recently had surgery, and I got tickled toward the end because I got, people kept coming in the room and saying, now this is what procedure you're going to have today. And 6 or 7 people came in and asked me the same question. And right before I went down to surgery, the physician himself came in and was talking about what the procedure was going to be and was marking on my body where he was going to be placing the incisions, and wrote on my belly what the procedure was, so that when I got to the room, there would be no confusion. I mean, that's insane.
Yeah.
But I was really glad they wrote on my belly. It came off, a couple of weeks later. A couple of weeks later, because they wrote it in Sharpie, I think, to make sure that it didn't come. But I don't know. But
they write. The bottom line is, I think you believe like I do, is that people, we certainly don't want people to be, just be said, well, that's just, unfortunate that happened, and they need to be some compensation. But when you completely, throw the whole system out of kilter, I think that's something that has to be seriously looked at.
Congressman, as we come to the end of July, I guess the question is, this is sort of a straight political calculus. How determined is the White House and how determined is the Democratic majority to push this thing through by the end of July? And I'm wondering, we've heard these horror stories, unbelievable stories of amendments being voted on that nobody's read, bills being voted on nobody's read. Could that happen with something as important as health care reform?
Well, absolutely it could, and that's I think a lot of the ways that some of the ones that want to push the health care system, they want to get it through the system before a lot of the American public realize what is in the bill. One thing that there's been a movement, I know, across the country, and before any health care system comes to the floor for a vote, there would be at least 72 hours for the American people to be able to chance to look at it. And that's only a fair, that's not asking too much for 72 hours, preferably more, but at least 72 hours. And so I think need to call their members of Congress and ask them to please pledge that there will be no bill that will come to the floor unless there's 72 hours that people can look at it. And therefore, I think that's where, when the American people realize what's in the bill, then there's going to be some great consternation and some great reserve about moving forward with it.
Well, again, along the political lines, Congressman, when push comes to shove, is this going to be a straight party line vote, or are there some conservative Democrats who are going to be cautious about
there'll be conservative Democrats that are going to be very cautious, and I would just tell your listeners, if your listeners live in one of those districts, to call your congressman and just, no matter who he is, but especially if he is a conservative Democrat, and encourage him to hold tight, because he's going to be getting a tremendous amount of pressure from the other side. I don't say the other side, from the Democrat side, and wanting to push this legislation through. So they need to hear from you, but also every member of Congress needs to hear about how people feel about this health care issue, because it'll be one of those pieces of legislation that will impact the entire population as opposed to one particular group. And with that, I have been called to the floor for a vote, and so there's a vote on the floor right now, so I'm going to have to slip away, and maybe we can pick this up again another time.
We would love to talk with you again. Congressman, thank you for your time today.
You're welcome. It's good to be with you, and look forward to giving an update as we progress through this process.
We'll look forward to it. Thanks.
Okay. Thank you.
Thank you.